The first disclosure is Mydose coach has been developed by Sanofi in Boston, and I have only carried out a clinical trial in India. There are only 2 centers, one in California and one in India. I only designed a study, a pilot project, which is executed at half a dozen centers in Apollo Sugar Clinic network. We know that insulin is the mainstay of treatment. Large majority fail eventually on oral agent and have to go on an insulin. The initial insulin initiation is done with a basal insulin, and as we know that dose initiation is done with 0.2 unit per kg body weight, and many patients go upwards to a recommended higher dose of half a unit per kg body weight. But insulin initiated does not take half of the people to a target level of A1C. The reason being there is a delayed initiation or there is an inadequate titration. Major reasons being 2. Studies have shown that A1C more than 9% or more than 10% do not reach a target A1C of 7%. So inadequate titration of the dose remains a barrier. Partly, some of the patients develop hypoglycemia and the dose gets down titrated and patient remains uncontrolled. Use of a titration in real life shows that most patients can achieve. The difficulties are patients do not frequently visit clinics for a dose adjustment, and as physicians, we do not provide them kind of an algorithm to adjust their own doses. So there is a need for a connect, and that connect is what is being provided by technology, what we call it an app. As we see that if patient is given an algorithm to titrate, there is one paper published on glargine insulin where self-titrated glargine was more effective than physician-titrated glargine. We would not go into the details of self-management, that has been said, and there is a way to empower the doctor or a way to empower the patient. Basically, there is a transformation in healthcare because there are a lot of data being generated. Data analytics have given a lot of light how we should treat the patients if you take lessons from data analytics. So coming to a subject of Mydose Coach app, this got an approval in March 2017 at US FDA. At that time, there were already 2 apps approved for injecting a bolus insulin developed by Eli Lilly and also for a bolus app by Roche. So 2 apps were approved by US FDA prior to March 17. This is the first app approved for basal titration. As you know that there is an app on a patient's mobile, there is a cloud where the data are being stored and is connected to portal of healthcare team. So at every diabetic center, there would be a team who will look at patient's blood glucose data on ongoing basis, practically every single day. So Mydose Coach is an app on a smartphone to be used by type 2 patients. So it is currently being developed only for type 2 patients, and it will adjust a basal insulin dose based on a fasting blood glucose. Most interesting part, for every single patient or for every single clinic, app could take up an algorithm what you would like to use. So every clinic would be asked what kind of adjustment you require, and it could be adjusted for your requirement. In the current study, I adjusted and created an algorithm for half a dozen clinics in different cities of India, and we followed a standard protocol. The only requirement was fasting blood glucose monitoring. We did not take any patient who would be using bolus insulin. This is of course how it would look on a physician console. We'll have a login ID. This is an app on a patient's mobile, and it has only 2 things available: fasting blood glucose and a dose of basal insulin. Basal insulin could be glargine, it could be degludec, or it could be U300 glargine, which is marketed as Toujeo. So it is not specifically, but our study was focused only on glargine. So Mydose coach, which gets launched in 5 different cities of our country on 1st July. So large majority of the physicians practicing diabetes are going to take patients on Mydose coach starting from July, and this would get people or diabetic patients more quickly to a target. It is seen that we spend lot of time in up titration of insulin. So if insulin is frequently up titrated, probably we would reach target fasting blood glucose very quickly. The aim of the study in Mydose coach was to get people at target fasting of 110 milligram within 30 days, so that by 12 weeks we may be able to capture a change in A1C in a 12 weeks clinical study. So there was an efficient titration management, comfort of knowing that patients are under control. Patient could check blood glucose every day or every alternate day, focus time on patients doing something else. They need not visit a physician for adjustment of an insulin. Most of the patients did not visit the clinic for 12 weeks when they were on Mydose coach app. Objective was to see the user experience primarily, whether app is working technically, technologically perfect or not, which it worked without much any technological hitch. App never went out of a protocol and adjusted larger unit or reduced larger unit. So app perfectly functioned as per the design in algorithm, and it did not look at any kind of a prandial blood glucose. It looked at only fasting blood glucose, and based on the fasting blood glucose, doses were adjusted every 3rd day. So we decided to have 5 adjustment in first 15 days every 3rd day, and then a weekly adjustment. So our target was to have 8 titration happening within 30 days, with a presumption that if the dose initiation was 10 units, by 8 titration most patients would reach a target fasting blood glucose. This is kind of a algorithm we used. 90 to 120 was the target, between 120 to 150 plus 2, more than 150 plus 4. This is for hypoglycemia, minus 2 and minus 4. This is with consensus of 6 investigators across the country. 150 patients completed just 3 weeks back, awaiting the result analysis, but primary results indicate that we achieved glycemic control within 40 days of achieving a target fasting blood glucose, which resulted into significant improvement in HbA1c. Registering a patient took only 5 to 10 minutes. It was very easy to explain, very easy to download, very easy to connect and initiate. You require a one dedicated team member at each clinic who is tech savvy, and he would download app right in the clinic when patient has made a clinic visit. Patients require a separate diary to record postprandial blood glucose as far as possible and not enter into the column of fasting blood glucose. Despite many barriers, digital industry is growing, though we have less people here, and what technology can do. Shortly we are going to have another app which is going to titrate a bolus insulin, so, which would be more useful for type 1 diabetes. So we are planning currently a couple of studies on additional bolus insulin adjustment for patients who are on basal bolus treatment. So finally, in summary, mobile application is there to help physician implement a dose plan more effectively to have a connect between 2 visits. This app is the best for basal insulin titration, whichever insulin you use, and it would be freely available in a short time. Thank you.